Bismillahirrahmanirrahim. Today we're going to talk about a short lecture called Panoramic X-ray Interpretation. When to see and say this X-ray is diagnostic, when to think there is an abnormality or not. So, to say an X-ray is diagnostic, we need the length of the roots to be within normal limits, not to be shorting. For example, here always the lower centrals there will be shortening in them and some radiolucency. This is due to the bite plane that the patient bites on it in the x-ray. So here we need to see the condyle, the sigmoid notch and the coronoid process. Here we need to see the anterior nasal spine and the mid-palatal suture, as you can see here. Here, the sinuses. These are the sinuses, and this is the nasal cavity. So, we need to see all of those to say this X-ray is diagnostic. That's the start of anything. So, this X-ray is diagnostic. We can see the upper wisdoms. One of them is partially erupted. One of them is fully erupted. We can see the root canal treatment here looking good somehow. For example, in this x-ray, we would call it non-diagnostic because the space between the coronoid and the condyle is wide. The shortening of the roots is the same, but there is overlapping in here, so we wouldn't call this diagnostic. Here also similar, not diagnostic. We can see the coronoid process. You can see some part of it, but not that much. But it shows us the arch, the zygomatic arch. So we can see there is a lesion around the lower 7. We can see the wisdom. We can see that the root canal treatment here with the crown is over hanging somehow. We can see over eruption of the upper 8, and these are the things that we will be looking at. So for example, in this case, it's not diagnostic. I can see the condyles in it, and the roots are somehow all long or all long. Now so in this case, I can see the lower 6 having root canal treatment, the 7 having root canal treatment, the 8 being horizontally impacted or partial eruption a little bit. I can see the wisdom with missing of the apex. So this will make me suspect that this tooth is inside the canal. But I need to see the 7 signs that we talked about. The darkening of the roots, the deflection or the deflection of the roots, the narrowing of the roots, the darkening of the canal, the narrowing of the canal, the diversion of the canal, and bifid roots. So here I would order a CBCT for this patient, and the loss of the white line. Sorry, I made one extra actually. Sorry, the loss of the white line, the darkening, and the diversion of the canals, and the narrowing of the canal. Bifid roots, darkening of the roots, and narrowing of the roots. Sorry. So for example, this case, as you can see, it's all long. So we would suspect it's not diagnostic x-ray. For example, here we can see there's radiopacity around it. So this could be condensing osteitis, cementoblastoma, but it doesn't look like this. But that's how it's supposed. That's how cementoblastoma looks sometimes, but usually it could be condensing osteitis. We can see there's a remaining root in here. We can see the upper wisdom impacting. We can see the sinuses, and this is pneumatization. When it goes down in the space of the extracted tooth, it's called pneumatization. So here's another x-ray, as you can see here, about the lower wisdom and the closeness to the ID canal. I can see the white line, but there's deflection of the root, so this would make me suspect that the root hit something, which is the canal, so it deflected itself. So I would suspect that the root is close to the ID canal. I would go for a CBCT scan. Here's another x-ray. We can see the 6 is extracted. Another one, we can see the bifid roots in this case. So here an abnormal thing that what we can see on the panoramic x-ray. We can see condylar fracture here. We can see symphysial fracture here. We can see an abnormal looking fracture of the root here. Remaining roots, the wisdom teeth. So this is an abnormality that I can see with the panoramic x-ray. Here's another panoramic x-ray, but I didn't have the full one. But I can see the abnormality in here, a large radiolucency with displacement of the teeth and the roots. So this would make me suspect an abnormality or a lesion in this area. Here's another case with radiolucency that is not supposed to be there. So these are the abnormal things that I'm supposed to see, and when to see them and think they are abnormal. So for example, in this case, I can see these white lines. These are retainers, nothing abnormal in them. This radiolucency, this is the pneumatization of the sinus because it went down in the space of the extracted tooth. I can see we have a deflection, dilaceration in the root of the 6, so this will make the root canal treatment a little bit difficult. So I can see all of those, and I need to know them before I can make a decision about any case regarding extraction, regarding an abnormality. So for example, here this white line, this radiolucency here, is known as the mid-palatal suture. This is the anterior nasal spine here. Sometimes there will be radiolucency between the lateral and the canine. This is known as the canine fossa, so this is normal. Sometimes if there's a lesion in the lower 5, let's see if there's a picture. For example, here, I can suspect a lesion or the mental foramen in this case. So sometimes here, for example, this is the mental foramen, very close to the root. So sometimes you may suspect it's radiolucency, but it's not, or abnormality. It's not. It's normal. The mental foramen. The ID canal itself, we can see it as well. So basically, it's just short thing just to see and to know the X-rays and how to read them. Hopefully, it's good. Thank you.